So we'll talk about the Paget disease of the bone. If anybody has seen a case of Paget disease among you?
So I think
Avipray?
Abhipray has raised his hand.
Okay. Avipray, how are you?
I'm good, sir. How are you, sir?
Good, good, good. And where are you today?
Sir, I'm in US. It's morning here, so
Oh,
yeah, it's
yes.
a bright,
Okay.
bright
Yeah,
sunny day in Boston. In
I'm
Boston,
also
it's a
in
bright. Oh,
I'm
sir,
also
yeah.
in US.
Oh, nice, sir. In
Okay.
Texas?
In Texas, yes.
Oh, okay.
So anybody else want to participate? So Avipray, have you seen during your post-graduation
Yes, sir.
Paget,
Sir, yes, sir.
Paget,
Yes, sir.
Paget
Yes,
disease? Okay,
yes,
good.
sir.
So we will discuss all the details what can be asked in the Paget disease of bone. Last time, I don't know whether you guys were there in the basic course or even before we taken a lecture on remodeling. Avipray, what do you
Yes,
understand
sir.
by bone remodeling?
So, sir, bone remodeling is a continuous process where the osteoblast and osteoclast are in a very synchronized way. There's a bone reabsorption and bone formation going along with the normal physiological loading that keeps on occurring throughout our life cycle process. And there are various signaling pathways and hormonal pathways which interplay the role, and uh, there's a signaling and interplay between the osteoblast and osteoclast, and an understanding of more where how the osteoblasts are being derived, like they are from mesenchymal derivation
Good. So
and also.
what's the difference between a bone remodeling versus bone modeling? Do you understand difference between modeling and remodeling?
Sorry, sir, it got disconnected. Sorry.
Sorry, so can you hear my question?
Yes, sir. No, sir. Can you repeat the question, please? It got
I said,
disconnected.
what's the difference between bone modeling and remodeling?
So bone modeling is normal process where we are looking the normal growth physiology, where the osteoblasts are laying down the bone as the growth process keeps on happening throughout our life. I mean, from pediatric to adolescent, and bone remodeling is more when we are looking towards adult or more pathological process where the osteoclast and osteoblast start playing an interplay between them. And
Yeah, so there's sometimes these confusing terms. So from your point of view, when you're born, your bones are small, so they have to grow length and width wise. So there you don't have to have exactly synchronized osteoblast osteoclast activity. Normally growing, you want more osteoblast and hardly any osteoclast. Later on, when the shape of the bone is required to be formed, like medulla versus cortex, or the metaphyseal has to be broadened, diaphyseal has to be shortened, then osteoclast can play a role, but they don't act in synchrony. Osteoblast may form bone and then osteoclast may come later on. Whereas when bone remodeling happening, it is a fixed cycle. Osteoclast has to come at the same place. Sequentially, it has to absorb bone and then osteoblast has to form bone. And main reason for that is happening. We are almost 10% of our body. Every 10 years, new bone is being formed. So, and why we do it, one reason Abhipray has already said, because of the load bearing. So we want to put more bone where more load is required. That's Wolff law. Second is we continuously cracking our bone. So if you got a big metal, even stronger than femur, that is guaranteed that in 10, 15 years that will break. Whereas a femur, which is narrower than a tube, like, let's say a cycle tube implant you put there, big tube, double the diameter and double the stiffness of the material of the bone, even that will break. Whereas bone doesn't last for about 80, 90 years, and that's because bone is continuously repaired. So fatigue fractures, which are happening continuously, are being repaired, or stress fracture, fatigue fracture. So that's the second reason. One is load, one is continuous micro damage is being repaired. And third is bone is a reservoir for growth hormones and calcium and phosphate. So whenever you require these, bone has to be absorbed so that these can be released in the blood. So these are the few reasons why remodeling is so important. So Paget disease of the bone is first thing you need to know is the remodeling defects and how these defects happen in remodeling. We will discuss that. We will discuss its pathophysiology. We will discuss how to diagnose Paget's disease. So how exactly we will concentrate more on this, how the basic science-wise, how the Paget's disease actually develops. Then diagnosis both on the history, clinical examination, lab test, and X-rays mainly. Mainly that's all required. And then what is the current treatment? So that will be our aim of today's talk. So we'll come to this slide later on because it summarizes everything else. So as we were saying that bone is continuously remodeling, and in remodeling cycle, the first thing is bone absorbing cells, osteoclast comes. Suppose there is a damage here, and how the osteoclast sense this damage. Previously, we used to say these are lining cells, but now we know that most likely these are osteocytes, which has got a lot of dendrites type canaliculi, and they tell somewhere they say activation of osteoclast that I am broken here, come over. So then osteoclast come and they form a pit by absorbing a bone. So osteoclast has come and they form a pit here. So this is a pit is formed, and this pit is filled. Then osteoblast come. So let's say first 3 weeks, the osteoclast is coming, and then about 3 months time it required for this to fill. And normally from your age of 20 to about, let's say, in ladies up to menopause and male bit longer, this is very synchronized. Whatever bone has been taken away, it is being filled. So this bone is being filled. And that's what is a normal remodeling cycle. But what happened in Paget's disease is that this is a different, same way of telling. This is a resting bone. Then this is osteoclast, which has come and absorbed bone, and this is osteoblast, which has formed the bone. So this is a normal cycle. What happened in Paget's disease is the lot of osteoclasts are coming. So number of osteoclasts are much more, plus they were very active. That means if you see them histologically, they are bigger, they got many nuclei in them, so they are also functionally very active. The number is very big. So a lot of osteoclasts are coming and absorbing bone. And then since there are a lot of pits has been formed, then a lot of osteoblasts also coming. And these osteoblasts then forming the bone. And because of this abnormal cycle, a lot of bone is being absorbed and a lot of bone is being formed. It depends on where do you see them. You have different picture both clinically, radiologically, and histologically. That means if a lot of osteoclasts are coming and you pick up disease, then there is osteoclastic phase or osteolytic phase. Then a lot of you will see lysis. If it is when you're seeing a disease and a lot of osteoblasts being formed and osteoclasts are not that active, then that is called a blastic phase. And somewhere between, which is a common thing, is called a mixed phase. So normally you see in a mixed phase. Yeah. So Abhipray, you have understood the pathophysiology of it?
Yes, sir.
Okay, so summarize it.
Okay, so sir, here there's kind of a haphazard between the osteoclast and osteoblastic activity. So normally we say like the osteoclast will come and then reabsorb, and then the osteoblast will come and then fill up the gap by forming a new bone. But here the both are acting in their own individual way rather than going a uniform cycle. So sometimes we have more of osteoclastic activity, so there will be more like reabsorption of bone, and that could be seen in more of like initial phase of like we say osteoclastic, and then we have sometimes we have more of osteoblastic activity, and there is excess of bone which is being laid down. So that's also haphazard, and then there can be a mixed phase. So that's how we go with the Paget disease pathophysiology.
Okay, yeah. So that's pathophysiology of anybody else have raised the hand. Deepan, anybody else? We're not asking questions. We're just revising as we're going. So you don't need to be worried that you'll be asked questions. No question will be asked. So if anybody want to participate, just raise your hand so that we can, while we're doing it, we can revise same time. Okay. So that was the bone is being